So anxiety seems to show up. We were talking about the intersectionality earlier of different things between like stress and anxiety and also situational things. It seems to show up alongside other like learning differences and mental health issues. And like you were saying, even like gut health and, headaches and things.
Mhm.
What are some strategies that you might use with a student like who has, for example, both like ADHD and anxiety? And would this be different for someone whose ADHD symptoms caused anxiety?
It's a great one. There's a lot of layers there to undo.
Yes, that's a great question.
First of all, ADHD, anxiety, for example, are highly comorbid. So, in terms of anxiety disorders in general, again, I don't have this stat memorized, but it's a very high frequency where you see comorbidities. So most commonly would be mood, right? Like it's really hard to be overly anxious. So your mood takes a hit. We were talking about how mood symptoms are usually a sign you need more help. So there's that angle, but definitely on the neurodiversity, learning disorders, ADHD, autism, all that umbrella, we see a high correlation with anxiety. The interventions, we're going to speak in generality, right? Like the interventions don't always change that much, right? It's sort of like additive, where it's like, okay, you have anxiety, like here's the tools for that. You have ADHD, here's the tools for that. But there can be some cross pollination, if you will. Again, like they do actually change somewhat in terms of intervention. So, for example, I think the last part of your question, sometimes the anxiety is there because of the ADHD. And if we don't do good assessment, like if we're missing the neurodiversity, the cognitive profile part, and we just treat the anxiety, that's going to be that 1/4 that don't get better. And that's because the anxiety is actually serving a protective function to some degree, at least. So our classic example is perfectionism, sort of unhealthy perfectionism, like high standards. I have to do perfect. Everything's got to be perfect, no matter what the context. Think about ADHD, where you are more prone for errors, for missteps socially, academically, where that doesn't feel good, right? And everyone's trying to cope.
Right.
You do start to kind of double down on the intensity of how much you care about doing really well. Like I need to triple check, right? Because I have missed things in the past. So I think that's one area to start of, like we have to do the right assessment to understand, are these things sort of just there together, or is one causing the other? So if that's the case, we often like assess, we're like, oh, there's this learning disorder, or there's this ADHD, and that usually that's comorbid with anxiety and substance use. If it's a teen, like some other things going on, it's like they're really just trying to cope because they have this untreated profile that they need help with. And just to speak to the neurodiversity, it's not like ADHD and all that stuff is all bad. There are a lot of positives and strengths that come with it, but there are deficits that need to be addressed through behavioral and often pharmacological interventions.
Yeah, and I think one of the big things that we hone in on here is what is the function of the behavior, right? Like every behavior has a purpose, has a function. There's a reason for what we're seeing, and I think it's, to Adam's point, like it's super important to figure out, is it a chicken and egg scenario with, anxiety or depression presentation versus an ADHD presentation, and I think we might get into this a little bit later, but like a good example of this would be like an intervention at school, for example. If we have a kid that, it is a true kind of perfectionism presentation, there's an OCD flavor to it. But we also have a kid with ADHD, like Adam said, who might be presenting in that way by, overly checking, making sure they didn't make mistakes, really worrying about doing a good job. And those are we would treat those in very different ways, right? Like for the perfectionism side of things, the intervention that would be the most effective would actually be to reduce the amount of time that they have to do these things, not allowing for extra time on tests, making sure that, you gave it one good look through and you kind of have to trust that you did your best, versus a kid with anxiety or ADHD rather. We tend to see working memory and or processing speed be a little bit lower in individuals with ADHD. And so those kids actually really do need extra time to kind of get there. And, there's a function to their behavior checking. Like Adam said, it's coming from a place of trying to build that self-awareness and trying to kind of plan and prevent errors from happening in the future. So I think that's been a really important piece of our work is, you know, especially when we make school recommendations, we do a lot of collaborations with public schools, private schools. We want to make sure that we're understanding the function of the behavior we're seeing so that we're not providing accommodations that are going to exacerbate the problem.
Yeah.
Right.
So I think, you know, we have this cool thing here where we're really, you know, well-trained clinicians and we're really well-trained assessors, and like having that combination where it's not like we just crank out testing reports and never do the clinical work and vice versa, allows us to really understand these sort of nuances. So like you could go through, unfortunately, like years of therapy that won't get traction if it's because there's undiagnosed learning disorder, ADHD, or nonverbal learning.